Botulism is a rare form of poisoning caused by botulinum toxin, which is one of the most potent toxins known to science. This toxin is produced by the bacterium Clostridium botulinum. C. botulinum is a type of bacteria that thrives in low oxygen environments. It forms spores that can survive in a dormant state for long periods, even in harsh conditions. When these spores find themselves in a favorable environment, one with low oxygen, low acidity, low salt, and the right temperature, they can germinate, grow, and produce the botulinum toxin. This toxin attacks the nervous system of humans, leading to paralysis that starts from the head and moves down the body. This condition can be life-threatening if not diagnosed and treated promptly. Fortunately, botulism is quite rare in developed countries. In the United States, for example, there are typically fewer than 200 cases reported each year. However, its rarity doesn't diminish its seriousness. Despite its low incidence, botulism remains a public health concern due to its potentially severe outcomes and the possibility of its use as a biological weapon. Causes and types of botulism. There are several types of botulism, each with different causes. The main types are foodborne botulism, wound botulism, infant botulism, and adult intestinal toxemia botulism. Number 1. Foodborne botulism. Foodborne botulism occurs when someone eats food contaminated with the botulinum toxin. This typically happens with improperly home-canned, preserved, or fermented foods. The bacteria can grow and produce toxins in foods with low acidity and oxygen levels. Common culprits include home-canned vegetables, cured pork and ham, smoked or raw fish, and honey or corn syrup for infants. Commercial canned goods are rarely implicated in botulism cases due to strict regulations and safety measures. Number 2. Wound botulism. Wound botulism happens when C. botulinum bacteria infect a wound and produce toxins. This type has become more common in recent years, particularly among injection drug users. The bacteria can enter the body through breaks in the skin, growing in the low oxygen environment of a deep wound. Number 3. Infant botulism. Infant botulism is the most common form of botulism in the United States. It occurs when infants ingest C. botulinum spores, which then colonize their intestines and produce toxins. Honey is a known source of these spores, which is why it's recommended not to feed honey to babies under 1 year old. However, in many cases, the source of the spores is unknown. Number 4. Adult intestinal toxemia botulism. Adult intestinal toxemia botulism is similar to infant botulism but occurs in adults. It's very rare and usually affects individuals with altered gastrointestinal anatomy or microbiome, such as those who've had intestinal surgery or have been on antibiotics for a long time. In all these types, this toxin blocks nerve function by preventing the release of acetylcholine, which is a neurotransmitter essential for muscle contraction. When acetylcholine release is inhibited, the affected muscles become paralyzed. Symptoms of botulism. Symptoms of botulism can vary depending on the type and severity of the exposure, but they generally start within 12 to 36 hours after exposure to the toxin. The hallmark symptom of botulism is progressive paralysis. The classic symptoms often start with blurred or double vision, drooping eyelids, and slurred speech. These are followed by difficulty swallowing, dry mouth, and muscle weakness that progresses from the head down through the body. As the illness progresses, the weakness can affect the muscles involved in breathing, potentially leading to respiratory failure. This is why botulism can be life-threatening if not treated quickly. In foodborne botulism, these neurological symptoms may be preceded by nausea, vomiting, and abdominal pain, which typically occur within 12 to 36 hours of consuming the contaminated food. In infants with botulism, the symptoms can be less obvious at first. Parents might notice that their baby is constipated, feeds poorly, has a weak cry, and shows decreased movement. As the illness progresses, the baby may develop a flat facial expression, difficulty sucking, and generalized weakness, sometimes described as floppy baby syndrome. For those experiencing botulism, the symptoms can be frightening. Imagine suddenly having trouble focusing your eyes or finding that your eyelids feel incredibly heavy. Your speech might become slurred, as if you're drunk, even though you haven't had any alcohol. Swallowing becomes difficult, and you might notice your mouth feeling unusually dry. As the weakness spreads, you might find it hard to hold up your head or move your arms and legs normally. These symptoms typically don't cause pain, but the progressive paralysis can be very distressing. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of botulism. Diagnosing botulism can be challenging because its symptoms can mimic those of other neurological disorders. However, prompt diagnosis is crucial for effective treatment. Doctors typically start with a thorough physical examination and medical history. They'll look for the characteristic descending paralysis and ask about recent food consumption or potential exposures. Laboratory tests are essential for confirming a botulism diagnosis. The most definitive test is detecting the botulinum toxin in the patient's serum, stool, or vomit. However, this test can take several days to complete, and treatment often needs to start before the results are available. In some cases, doctors might perform a nerve conduction study or electromyography to help differentiate botulism from other neurological conditions. For foodborne botulism, health officials will try to identify and test the suspected food source. This is important not only for confirming the diagnosis, but also for preventing others from consuming the contaminated food. In cases of wound botulism, doctors will examine and possibly take samples from any suspicious wounds. Treatment for botulism. Treatment for botulism typically involves supportive care and antitoxin therapy. Supportive care is crucial and may include mechanical ventilation if breathing muscles are affected. Patients are closely monitored in an intensive care unit, where they can receive assistance with breathing and feeding if necessary. The primary treatment for botulism is the administration of botulism antitoxin. This antitoxin can stop the progression of paralysis by neutralizing any toxin that hasn't yet bound to nerve endings. However, it can't reverse paralysis that has already occurred. That's why early administration of the antitoxin is so important. The sooner it's given, the better the outcome is likely to be. For infant botulism, a special immunoglobulin called baby bake or botulism immune globulin intravenous is used instead of the standard antitoxin. This treatment has significantly reduced the severity and duration of illness in infants with botulism. In cases of wound botulism, in addition to antitoxin, treatment involves cleaning and debriding the infected wound and administering appropriate antibiotics. For foodborne botulism, doctors might try to remove any contaminated food still in the gut through induced vomiting or NMS, although this is only helpful very early in the course of illness. Recovery from botulism can be a long process. As the toxin's effects wear off, nerve function gradually returns. However, this can take weeks or even months. During this time, patients may need ongoing supportive care and rehabilitation. Physical therapy can help patients regain strength and function as they recover, while botulism can be very serious. With prompt diagnosis and appropriate treatment, many people recover fully. However, they may experience fatigue and shortness of breath for years after the acute illness. In severe cases, or if treatment is delayed, botulism can result in long-term disability or death. Prevention of botulism. Prevention is a crucial aspect of managing botulism risk. For foodborne botulism, proper food handling and preparation are key. It's very important to boil home-canned foods for 10 minutes before eating them, as this can destroy the botulinum toxin. To prevent infant botulism, parents and caregivers should not feed honey to infants under 1 year old. For wound botulism, prompt cleaning and proper care of wounds is important, and injection drug users should be educated about the risks. Interestingly, while botulinum toxin is deadly in large amounts, it is found therapeutic use in small, controlled doses. Botox injections, which use a purified form of botulinum toxin, are used to treat various medical conditions including chronic migraines, excessive sweating, and certain muscle disorders. They're also famously used in cosmetic procedures to reduce the appearance of wrinkles. Now, we want to hear from you. Have you encountered a botulism case before? What symptoms did you have at first? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.